Hi, Dr. Ahadian here. I had a request about a video was done about obsessive personality and changes and differences between the obsessive compulsive disorder and obsessive personality, and someone was asking, well, how are we going to live with someone who has obsessive personality disorder? First, the issue with regard to obsessive personality disorder, it's a very complicated situation with regard to the manifestation of the problem and the differences between the obsessive compulsive disorder. First, obsessive compulsive disorder is a condition that the person who's suffering from that wants to change, does not want those rituals that are happening, like doesn't want to wash his or her hands like 5 to 10 times a day, does not want to keep touching things 5 or 6 times a day, or 5 or 6 times, to kind of avoid and divert some other kind of problem that he or she feels that will come to their mind, and on and on and on, which is a important situation. So it's ego dystonic, as they talk about it, which means the person does not like to have those kind of symptoms and try to avoid that and try to get rid of it. However, obsessive personality disorder is a condition that the person who suffers from that is very comfortable with that, wants to be like that, does not want to live any other way, and gets frustrated if things are not the way they want. Like, they have to be very on time, they have to be very proper, they have to keep things very clean, they have to be very perfectionistic, they have to talk in a certain way, they have to be careful about their behavior, they want to have everything spotless, everything clean, everybody to be on time. And this is a situation that we have a issue with the person who's suffering. We think about, he or she is suffering, but I mean, the obsessive personality disorder, usually they or the person or the patient does not feel that there's anything wrong, and they're very optimistic and they're very gung-ho about how they want to live their lives. Now, living with a person who has obsessive compulsive disorder versus living with a person who has obsessive personality disorder is very different. Obsessive compulsive disorder, are the partner, the person, the wife, the husband, the child who is around is very concerned, very upset, very depressed, very frustrated. So we have to be very understanding. We cannot be demeaning. We cannot be educating. We cannot be trying to put him or her away from what they have to do to get rid of this tension and frustration that they're feeling. And by demeaning and devaluating and rationalizing and judging, the problem will get more and worse. First of all, we have to understand that there is a genetic precondition about every kind of like a disorder and even order in life. So basically, with understanding that, we would be able to more understand the suffering of a person who's going through these obsessive thoughts and behaviors and problems that he or she has. And hopefully, if there is a lot of problems and tension and frictions that are happening around them, to get treatment, to get help, to get discussion, consultation, to sit down and work it through, to understand this condition, to understand the genetic, to understand the root of this condition, to treat the condition with medication. There's a lot of medication because there's a lot of biological depression and substantial changes in chemistry of the brain in the people who are suffering from obsessive compulsive disorder, which antidepressant medication serotonin inhibitor, reuptake inhibitors could be very helpful, not because they're crying throughout their lives, but because of the manifestations of these obsessive preoccupations, which is the secondary reaction of the tension that's caused by the biological imbalance and changes in the brain system. Dealing with someone who has obsessive personality disorder is very difficult because, first of all, we're dealing with something that the person does not want to change. They feel really strong that this should be the way to go, and that's how it should be done. Then there's going to be a lot of issues related to us as people who are around this person who's having obsessive personality disorder, feeling pressure, feeling tension, feeling sometimes feelings of acting out, feelings of passive defiance, feelings of destructive behavior, even to ourselves, in order to get back at the people who are exhibiting this obsessive personality structure and controlling attitude. And that by itself is a problem, because then we're going to lose the track of how we are being self-destructive, demeaning to ourselves, decreasing our own success in life by just getting back at a person who is consciously or unconsciously, mostly unconsciously, being in a situation to be controlling and to be trying to keep everything in control. Now, again, until there is a conflict, until there is a problem that would ensue, that would be destructive to the relationship, there is no way that someone will be able to change someone's obsessive personality structure. We see a lot of type A personalities that have obsessive personality structure, CEOs, high functioning people who are in very high functioning positions, and at the same time it's very difficult for the people who are living with these people, and until there is a crisis and loss that the person would suffer, who's suffering from personality disorder, they will not go to get help and to change the behavior. So then we have to be very careful as people who are around them, in order to be able to adjust ourselves, to come to our reality, to be thinking, to be careful, not to be self-destructive and adversarial, even though we know that sometimes they're right, and then by just being acting out and being against them, we're going to cause the problem to intensify and then be self-destructive. So one of the issues that's very important to live with someone who has obsessive personality disorder is to be very careful not to fall into the problem of acting out and being negativistic and negating and oppositional, because again, at some point we are going to be then self-destructive to ourselves and then cause trouble to ourselves, because we want to prove them that we are right. And that's very difficult again, and it's something to be talked about in the future, hopefully. Thank you very much.